Hey guys, Lauren Losing here for my 1 month post-op bikini body shot from my plastic surgery. I had plastic surgery on May 26, 2016 at Massachusetts General Hospital with Dr. Amy Colwell. I had a brachioplasty, which is an arm lift, a mastopexy with augmentation, which is a breast lift with 325 cc silicone implants, and a belt lipectomy, which is a 360-degree lower body lift. I had all of these procedures done after having weight loss surgery. I had vertical sleeve gastrectomy surgery on August 21st, 2013 at Massachusetts General Hospital with Dr. Denise Gee. As of the last time I weighed myself, I weighed 120.5 pounds, which is a loss of 148.5 pounds from my high weight. Brain fart. Okay. Also, I'm 5'2". So, I am wearing the same top as I was in my pre-plastics skin flick. I am wearing a different set of bottoms, which are a little too big. You guys are gonna see some marks on my skin because I literally just took off my binder and my sports bra and all that stuff, so you're gonna see some marks from that, but I will show you everything. I will show you the update on my scars. I will show you a little bit of my concern with my breast implants, and that's pretty much it. So let me just adjust this and we will show you. So these right here, that's literally the sports bra that I was wearing had ruching, so that's just marks on my skin. That's not like, that's not how my skin usually looks. So let's start with my arms. So this is what my arm incisions look like right now. The scar is actually lighter in person than it's showing on the screen, but as you can see, things have flattened out a lot. I do still have one little open mark right there, which is a stitch that is having a hard time dissolving. But yeah, all in all, it's doing really well. It's still like bumpy under the skin here with some stitches under the skin, but all in all, these are doing really well. There's still some bumpiness here where it's a little tighter, and I am doing some like range of motion exercises to try to loosen that up. And then that goes under there. So this is the state of my tattoo. So you can see that it did get cut into a little bit, but actually shouldn't be that bad to fix. I do have, if I can keep my arm down, I do have a very, very slight dog ear right there, but like extremely slight, like not enough to have surgery just for that. And then over here, it's pretty flat. So this is where I'll show you my concern with my breast implants. So they do look pretty good, but if you can see, the right one has settled a little bit more to the right, I guess. Like this, my left one is still, it's higher and not as lateral, I guess, as this one. And you can really see it when you can see like the implant standing out here a little bit more, as opposed to this one. Those are just my stretch marks. So if I do this, that really makes it a little bit more even. So I'd say it's about a ½ inch that it's settled a little bit more to the side. I am gonna call my surgeon and just make an appointment with her, hopefully go in this week, because if it's something that actually needs to be fixed, I would rather get it fixed sooner than later, as opposed to having to wait another year to, you know, accrue more time off or to do another medical leave to fix it. I would just rather fix it now if possible. But honestly, like if she says it can't be fixed yet and she'd rather, let me bend down, and she'd rather wait 3 more months to see how they settle, then, you know, it's not the end of the world. It's not the most glaring. It's not like I have a tit down here and one up here, but it is something that I've noticed that it's just settled a little bit more to the side. All right. And so these marks on my stomach, I'm sorry for the shit back here, but these marks on my stomach are literally just from my binder. So I am wearing these a little low. So this is what my stomach incision looks like now. Again, it looks darker on screen than it does in person. So it's looking good. This is what my belly button looks like right now. It looks so small to me. But that's looking pretty good as well. I do still have like a little open area on my hip here. And I think that's mostly, honestly, because my hip bone is pretty much like right under that incision. So I think it's a little harder to heal. And also, this is where my drains came out of last. But the incision is looking pretty flat and shiny, which is a good stage of healing there. That's my butt crack, sorry. So yeah, this is how high these hip tattoos are now. I think is so funny. But yeah, that's pretty much it. So let me see if I can back up and show you a whole thing. So this is what I look like at 1 month post-op. So again, I am very happy with my results. Let me just say as an aside, this breast implant thing, this is not like surgical error. This is just something that can happen when you put a foreign body in your body. You know, like they're not necessarily going to react the same way. You know, removing extra skin and putting things in that aren't naturally there. This is like, so many things can happen. So this is not like a surgical error. This is just a possibility that can happen with breast implants. And like I said, it is not like this emergent thing. It's just something that I've noticed. So I hope you guys enjoyed this full body shot update, and until next time.